afternoon. Yeah, it's a pleasure to be here to talk to a lot of young people, especially in the healthcare field. I'm going to be talking about digital health and the future of healthcare practice. I just have to lay it out in the beginning that digital health is not likely to replace mainstream healthcare, but it's a big plug because we do have a lot of deficits. There's a lot to talk about. We'll also be focusing on, towards the end, how to unlock the youth potential. I think I'll also just give a spoiler to what happens in the end. Youth have a big advantage. One is that I believe I'm talking to the Dicks, you're pluripotential. You have so much potential, there's so many fields you can go into, and your way of thinking hasn't been beaten by life into becoming a very narrow way, so you're still very general, very innovative, very creative. There's so much to talk about, but I'll try just to focus on this. We'll define some terms, we'll look at how is the health space in Kenya looking like currently, and then we'll see what really makes digital health an option in Kenya. Are we right for that? How is our digital literacy and so on and so on? How applicable are these things? How expensive is it to implement? Then I'll talk a bit about health techs, and then we'll see about how to bring this into the youth. But the youth, I'll be looking at it in two ways. One, the general youth population, and two, the healthcare providers, the young healthcare providers, if we put it that way. Yeah. So just a few definitions. You see a lot of things thrown around: e-medicine, telemedicine, telehealth, digital health, and so on. Not to spend too much time on this, telemedicine basically is the actual practice of medicine on a digital platform, remote diagnosis and treatment. Telehealth now is a bit bigger. It's a bit big of an umbrella, which covers both clinical and non-clinical services. Like, for example, if we're doing an online CME, that kind of comes to telehealth. Now, digital health is any involvement, any place where you involve technology in delivering healthcare or in health services. It could be the Fitbit that you have on your hand, or anything that involves technology. Now, digital health comes to cover that. It's important because, as you know, we currently have a Digital Health Act, which I was fortunate to be part of developing it. And the terms really confused us. So WHO came with this. It's very easy when it comes to understanding what it is you're legislating and what you're talking about. Universal health coverage, I'm sure you guys have heard about it over and over again, and SDG 3, which is why we're here, is to ensure healthy lives and promote well-being for everybody at all ages. Current health state in Kenya, we have a lot of challenges. Accessibility issues, most people, 42% don't have a facility have a facility within 8 kilometers, 52% have a facility within 5 kilometers. Most people, as you know, most providers prefer working in towns, so you find that we have 80% of the doctors serving 20% of the population, which is really skewed. Affordability, only 25% of Kenyans have health insurance. Remove NHI from that, it goes way low to I think 6% currently. There's a low doctor-patient ratio, as we know. I think the recommended is 1 to 1,000. Currently have 1 to 4,000. And data information and gaps. If I ask you how many cases of breast cancer we have in the country, if you Google it, the first thing it will tell you is that data collection in Kenya is missing, but it is estimated, as it's usually the beginning for most things when you're looking at data. And with these challenges, we can't keep reinventing the wheel. We have to do things differently. Albert Einstein, and there's so many quotes that say the same thing in different words, saying that we cannot solve our problems with the same thinking we used when we created them. So that's why we need to innovate, see how we can solve these gaps. And the second part of the presentation I'm going to be answering is Kenya ready for digital health solutions? And then we're going to look at what we've been doing as Health Ex Africa. There's a lot, but I'll try to simplify it, just hit the core issues. So I'm also going to be speaking like a pastor a lot, just from the heart, because some things might not be on the slide. So next. You will be surprised that we're doing pretty well when it comes to our digital literacy and our digital reach in Kenya. And I want us to move our thinking from thinking that digital usually means complex solutions that are hard to understand or that need somebody who has a degree like you guys, who is in university like you guys to understand. You have to simplify it. It's very easy. Like for example, from the data that we can see, 64.4 million people, there's 64.4 million SIM cards in Kenya with a population of I think about 52 million. Of course, it doesn't mean that everybody has a SIM card. We know there are guys who have 10 SIM cards, con men have 100. So there's usually 100, a lot of SIM cards, but it basically just gives a reflection that we do have a lot of penetration. About 46.7 million of those SIM cards are, have some internet subscription or have had some internet subscription at some point in their lives. We have more mobile phones than people. Again, there's some people who have way more than one. But I think the next statistics are very important. 26.5 million of the population has a 3G internet connection where they live. And about 33.6 have both 3G and 4G connections. So about 96.3 doesn't mean that they can access it or they can afford it, but they live in an area where there is some coverage. That covers about 56% of the surface area of Kenya. This is because our population is not equally divided. Some places have more people than others, so there are places that are sparsely populated, so there is no network there. That's why there's that difference. And 2G, about 96.6% of the population has some 2G coverage, and this is about 56.5% of the geo area. So if you ask me, we are ripe for digital health in Kenya, and the benefits, just running through them. This list is by no means exhaustive. We can manage patients right where they are, and I'll show you how that's important when we come to our experience. We improve the experience of the patient journey. For those guys who've seen patients, I'm sure everybody probably has had this experience, whether you're a doctor or a pharmacist, where a patient comes to you, gets the medication, and then they leave the office, then they come back and knock, especially on a day like today, which is Friday, then they tell you, daktari niko na swali. And you ask the guy, what's the question? And the guy tells you, hii dawa naweza tumia na pombe. Especially on a day like today. So with this, a guy doesn't have, and some of them go home and they don't know it, they're not sure. A guy has flagging and he's thinking, can I drink, can I not? But today is very important, I have to drink, and then he comes to see you the next day or something. But with this now, he can easily just call you and ask you any questions he has. Drug interaction, such things. So that's how it improves the patient journey. Better treatment outcomes in certain specific scenarios. This has been shown in things like hypertension, to some extent diabetes. There's actually data for that. Real-time patient monitoring, risk assessment, helps in promoting and preventing health. Empowering patients, giving them information all around. It's very easy. For those guys who've seen the healthcare apps, they're probably bombarding you with information all the time. Sometimes you think you're actually harassing the patient with it until you stop sending those education things, and then the patient starts asking you what happened. You guys are not active anymore. Helps towards bridging the gap when it comes to treatment, to achieving UHC and health information systems, which is the main reason why the government actually wants this digital health thing going, so that they can get data and know what's happening. Next slide. There is a plan for government. It's actually now in legislation that all health facilities, public and private, to share their data. Anonymized means you can't identify somebody from the data. Anonymized data, so they can actually see like how many cases of URTI, how many cases of tonsillitis, how many cases of breast cancer are diagnosed, how many CSs were done in both private and public facilities. I don't know how long it's going to take, but I've been told within 18 months it should start taking effect, that we should all start sharing our data. So, about HealthX Africa, so we are a Kenyan-based primary healthcare service provider. Primary health means the first point of contact that the patient has, generally. The problem we're trying to solve is low access to high quality care, and our core functions is to keep our patients healthy. It's not just to treat them when they're sick, but to prevent them from getting sick. We have a very ambitious vision, which is a doctor for every Kenyan. So when you think of us, of HealthX in particular, there's usually organization. There are different models of delivering healthcare. There's people who have apps. Those, so it has like an Uber model for healthcare. There are those people who have things like health informatics. I believe we should be having a talk on that. There are quite a number of models. And those ones who are connecting facilities to each other, others who are providing EMRs. So for HealthX, what we have mostly is we're like a hospital. We have fully employed doctors, nutritionists, psychologists, customer care people in the back office to support all that. And then so we're like a hospital, but delivering most of our services on a digital platform. An app is just one of the things we do. So this I pulled from, there are some things that WHO usually requires when you're implementing a primary healthcare system. So I was just looking at it from the health aspect. So we have a multidisciplinary team. We believe it's not only your purely biological or clinical health that's important. That's why you have a psychologist for mental health and a nutritionist for lifestyle diseases. Then digital health services usually cannot exist in isolation, so you have to integrate with other providers, both digital and physical. Offer curative, preventive, promotive, promotive health services and systems integration. To the community, other than just offering the services through the app, mostly we give them health education, self-digital diagnostic tools, which could be wireless, meaning they can communicate directly to us or not, which means the patient has to feed in the data. If somebody takes his blood pressure, it's 160 or 100, they feed it into the app or call us and let us know. Some of them automatically just transmit the information to us. Empowering the patient by giving them access to their health records, which is becoming like more of a patient right now. And the patient has the power to initiate consults. It's not just the doctor who calls them. So this is just a lot of stuff to say that there's usually an issue when you're a digital health practitioner, where people are concerned about how you're keeping your data safe and so on and so on. So those are just some of the things that we're doing. Firewalls, not allowing phones in where our data is stored, access control and guidelines, and also DPA, Data Protection Act compliant, Office of the Data Protection Commissioner compliant. Probably one of the things that usually excite, especially young people or people who are new to digital health or getting into it, is the digital health tools that are offered in the practice, the digital health tools that we usually have. One thing that I will emphasize later on is when you're thinking of getting into digital health, your solutions could be complex. You could be hiring the most sophisticated, what are they called, software developers or think tanks and stuff. But to the patient, it must be simple. Otherwise, you'll just be talking to yourself. You come and say how you have this very sophisticated thing that is sorting out problems, but if the patient doesn't understand how it works or how to use it, you're likely going to be alone. So, but these are important just to know. And it's basically, this is as of I think 2022. The digital health tools that are available are going to keep increasing. So we have mobile apps, wearables, which can all be connected. Wearables could be also the biometric sensors could be the wearables or separate. Smartphone cameras are diagnostic tools that we're using currently. Even the smartphone microphone, like recently I had a pitch, you may say, with a company in India that has patented a technology where they can screen for respiratory diseases, things like TB, COVID, COPD and asthma with a high level of specificity and sensitivity, upwards of 70%, just by coughing into your mobile phone. It can detect your sound, and it's not diagnostic, it's screening, so it will tell you that this patient is likely to be having TB, so test for TB, or this patient is likely to be having asthma, and this level of FEV1. It can actually estimate things like your FEV1 just from you coughing into a device. So mobile phones are actually a big partner when it comes to this. Clinical trial tools, I've shaded it because we don't have that in HealthX. In-home connected virtual assistants, telemedicine and virtual physician visits, personal health records, web-based or internet-based interactive programs, text messaging or email does fall under digital health. That's what I was saying. Don't always think complex. And health system disease management apps usually used by public health and government facilities. Yeah. So, won't spend too much time here, but for Health Ex Africa, we have an office that's sitting in Gigiri, but surprisingly, about 45% of our patients are outside Nairobi. So you can see, whereas you could prefer as a health provider for various reasons. You want your kids to have good schools, them to go to good schools, you want to live a good life and stuff like that. So you would prefer working in urban centers, but it doesn't mean that people who are outside urban centers stay unserved or underserved. So this does bridge a big way. How we've been able to do this? Partly through through us directly connecting to individuals mashinani, but big part working through counties, county governments. Health is devolved, so a lot of initiatives you have to go through the counties, and counties and NGOs. Yeah, there are NGOs that already have programs in the ground. So sometimes they just need a digital health solution. So if you can really think fast and help some of them, like I'm glad I have Mary Slopes in the house and they have digital health solutions. You can provide services mashinani. Like we have a program where we're working with CHPs, creating employment in that aspect also, who just help us with some programs that we're doing indirectly through NGOs. This is a medical camp that we usually do annually. So this is one of the tools that we usually have. We call it a virtual clinic. You have this screen over here, then you have digital health tools that are wireless, and you have somebody who helps you with vitals. Like in this case, it was actually just the company directors. The guy with the hat there is the Narok County Governor. So there's just take blood pressure. You show him how to you can train them how to take a blood pressure, the temperature, and so on. Once they do that, it sends the vitals there, and somebody can have a video consultation with the doctor all the way in Gigiri. We will be having another one on 3rd to 6th December this year, still in the Mara. See how that will go. This is a virtual clinic. That's me, that's a virtual clinic that we have. So this is another special one. We mostly intended it to be deployed in fat-rich areas. It's purely solar powered. Where this photo was taken was in Kericho County during the Mashujaa UHC launch, that was done by the president. So that time it was really raining, really thoroughly. The place was really muddy. This thing is solar powered. That we actually, ask people to walk around and confirm that it's not connected to any wires through the sun, kind of like Superman, but using solar powers, just through the sun. We managed to power it and actually had a few consultations from here to our center in Nairobi. Yeah. Initially intended for remote places, but schools, funny enough, have really jumped onto it. They really like the idea. And future of digital health, especially primary healthcare delivery, looks good, but it depends on buy-in from the governments, which currently is good, government regulation, which currently is supportive because there's a lot of public participation in that. Consumer trust, which we are building, daktari umenitibu kwa simu, I don't feel like I've been treated. Daktari hata kunigusa ama kuniona. So there's usually that level of trust. But you also should be honest as the providers to what you can do and what you cannot, because the truth is you can't treat everything on a digital platform. And ability of health tech innovators to reach vulnerable groups. So lessons we've learned when it comes to this. First thing I say, keep it simple. No matter how complex your decisions, your solutions are in the back end, it must be simple for what the patient sees. Like for us guys, I think the simplest thing we have is a USSD. Start something harsh, then it asks you questions, especially if we use it for a program we're doing for expectant mothers. Do you have any bleeding, blah, blah, blah. Then if it flags anything, it connects directly to the doctor. Then there's a toll-free number you call for free. And then it gets even more complex than that, where you have now the video calls, you have the chats, those ones need internet and a smartphone. Toll-free number, USSD doesn't. Then, now when it comes to the remote monitoring, where you have to train a patient how to measure their blood pressure, measure their sugar, using a wireless device. But it should be as simple as possible and you should think about it from the patient's perspective. Keep it affordable, very important. There are people who don't mind paying premium, but the most are very price sensitive. Where we are in Kenya, people are very price sensitive. And keep it practical. How can it be used? How can it be scaled up also? So as I conclude, I want us to think about, what's in it for the youth? What's in it for the young people? What challenges do young people face? And what solutions can digital health provide for the young population? And what solutions can it provide for the young healthcare provider? So I mean, these are things we all know, but I'll just go through them again. Unemployment, 75% of youth. I think youth is still under 35. I mean, 35 and under, or 18 to 35 are the ones who are considered like adult youth people. 75% of them estimated unemployed. But if you actually broke it down and looked at how many youth are employed in the first year after graduating, I'm sure it's upwards of 90%. Access to health services. Challenge to all Kenyans, particular challenge to the youth also. You're unemployed, you don't have money, so you can't really determine where you're going as much as you'd like. Mental health needs kind of special when it comes to young people. We are seeing, I don't know if it's surgery cases or, are the cases of depression and anxiety rising, or is it our diagnosis of these cases that's rising? I don't know. And substance use and dependence, always been there, but the easier it becomes to access drugs, the more this becomes a problem. Youth empowerment, youth mostly feel, or are, they don't feel, they tend to be a bit, their voices are not felt, if I put it that way, and tend to be ignored. It happens to most Kenyans, but I think it's more in the youth. Because the older you're growing, as much as most of us are still voiceless. But you find that there are people who rise through the ranks, so you probably, even you guys as you grow up, some of you become the powerful people, some of you become friends to powerful people as time goes on. And you tend to be less and less voiceless. But when you're younger, it's a bit hard to get heard. And access to education, maybe, I'm sure even in this room, there are some people who, they told you the story it took, they told you the life story it took for them to get here, because us guys all have access to education at the moment. But for some of us, what it took to actually sit here today, if somebody told you that story, they could write a book. But yeah. So access to education is a problem to everybody, to the youth especially. Access to financial resources, a challenge for all Kenyans, but also particularly challenging to the youth. Access to healthy leisure and recreation. A lot of words there, but I'm going to look at it in two ways. How digital health technologies can benefit the youth as a population. Education. Some of us are, probably even in international schools where you are. Mental health support. Remote consultations, so it increases accessibility of health. Health monitoring for the youth, fitness and tracking, preventive health, and support for chronic conditions. Management of chronic illnesses, sexual reproductive health, a big topic, especially in the morning from what I caught on. And digital health platforms tend to provide safe spaces, if I may call it that, for the youth, even for mental health, which I'm not seeing there. Healthy lifestyle promotion. These things are important when you start young, because by the time you're probably 35, 40, going up, you've probably planted a foundation. If you haven't been living a healthy life, there's some things that have already started going wrong by that stage. And reduce the cost of delivering health services. So now how will it benefit you as a health service or healthcare provider? You have access to information and resources. I remember when I was interning many years ago, and where I had been posted, there's no way I could attend a CME. Those CMEs where you get your CPD points for professional development. There's no way I could attend them. But with digital technologies, where those guys are right now, they can even be the ones conducting them, because you can reach them on a virtual platform. Things have really changed. It's not very many years ago. Remote consultations and telemedicine. So even as a young person, remember we have a challenge of unemployment. Even as a young person waits to be employed, or even when they are underemployed. You probably have locums where you're working 2 days a week. Digital health platforms actually give you that platform where you can plug in that time, create your own patient base, be seeing your own patients. There could be people who know you and people who don't, so that you actually continue working. I think this is probably the most important benefit to youthful HCP, the fact that you can actually build your own client base as life goes on. And it gives you some flexibility. Gen Zs like flexibility, they don't like really being tied down. So it allows you to work as much as you want, when you want. But remember, digital health is not a one-all solution. Probably some patients still will need to be seen physically. Remote patient monitoring, which will improve your patient's satisfaction. Electronic health records makes things cheaper. Before, for a lot of practitioners, especially of the older age, you probably needed to employ 2 secretaries, one for your patients, one for your files, something of the sort. Right now, you can do all that, just on a digital platform. I'm sure a lot of you guys were brought together, using digital platforms. We came together and Right Culture. So it's very easy for youth to collaborate, communicate and collaborate, form group practices, or find something that they have in common, form groups, find solutions collectively using a digital platform. I don't know how people used to do it before. I don't know if they used to write a letter to post and just write random addresses and post to people all over the country before you can come together. But right now you can just do it on a WhatsApp group, all the other social media platforms. I was about to say Facebook, but I remember it's for old people, might not really be practical here. Yeah. Patient engagement, you can educate your patients, give them limitless follow-ups, which will increase your satisfaction, their satisfaction. You can also get into research about digital tools, give that advantage of getting into research. So this is, I think, my last slide, or second last slide. This is something I'm borrowing from business school, which is what is called a business model canvas. Some of you have seen it. If you go to like a business course on innovation, you've probably come across this. And initially it was intended for, the primary use is it's intended for a business to look at itself and see how we're doing in these aspects. But people in innovation school realize that if you're thinking of innovation, even as an individual, if you're an individual consultant, you run a company. Doctors, pharmacists usually work in companies just by yourself, as you are. So if you are thinking of innovation, how can you innovate? This is a very good template to use. There are very many others you can use, but this is my personal favorite that I probably learned early this year or late last year. You have to look at it as a business model canvas, and this is something you can Google and see. What's the business model canvas for Uber, for Google, for which other companies can we think of? Creative companies, basically. Just see what it is that they're thinking. So I'll explain it in brief. Even for Microsoft, companies that score highly in innovation in all these aspects tend to do very well. And when you're thinking innovation for anything, but right now we're talking about digital health, you have to start with your customer. 2 things you're going to look at. What segments are you targeting? What customer segments are you targeting? And this can be different. Could be socioeconomic, could be gender, could be age, many other things. Educated versus non-educated, but define the segments, and it could be more than one segment, and what's your value proposition. If you don't start with the customer, you're innovating for yourself. You have your own idea. In this case, the customer, I guess, is the patient. If you're not thinking about that, you're just talking to yourself and assuming the problems that are there that you're sorting. And then from there on, you have to think of the other things. The kind of relationships that you're having, and you have to try to be innovative in all these aspects. The channels you're using to reach your clients, who are your partners going to be? Like for example, us guys are a health service provider. So when I think partners, I think of who's going to deliver our medication, who's going to do our labs for us, who's going to be our inpatient, who's going to be our specialists when we need specialists, who are going to be our insurances. Those are the things I've been thinking of. Activities you're going to do, resources, and then down here you can see it as a very big box, because without money, whether you're an NGO, whether you are private, whether you're government, you won't be sustainable, and you might fail. So you have to be very innovative in how do we price our things, how do we get our money, and how do we control our costs. So that's why I like this template. It really covers all aspects of a business, even you as an individual.